So the main part of my talk was understanding the ability to risk stratify patients at the onset of GvHD. The graft-versus-host disease in the gastrointestinal tract is the most serious and difficult to treat. But we have biomarkers that are able to act as a kind of liquid biopsy that can tell us how much damage there is to the crypts in the gastrointestinal tract. And the biomarkers are able to give us something called the magic algorithm probability, or MAP, and that predicts the response to treatment at day 28 and the overall mortality at 6 months. And what we did in our presentation that I presented earlier this afternoon was to combine the clinical features and severity of each target organ at the onset of GvHD with the biomarkers. And our first finding was that if we use clinical variables alone, we can risk stratify patients and get 3 groups. But the low risk group and the intermediate risk group were very close together. If we now add the biomarkers to those 3 clinical risk groups, which we called Manhattan risk, we get something that's called the magic composite score. We also have 3 scores, 1, 2, and 3. The low risk have a very high response rate, 80%. The intermediate risk have about a 50% response rate, and the low risk have a 30% response rate. And the difference in mortality at 6 months is also very large. So we've now created a website called GvHDmagic.com, where you can put in the stages of each of the individual target organs and find out what the risk is for Manhattan risk. And if you have the biomarkers, you can get the composite risk as well, or the composite score. So we're very excited about this, and we are hoping that by putting it on a website, it will be available to all of the people who want to be able to use it.